Welcome. Good to see everybody. My name is Alice Clark, and I am the Executive Director of the Downtown Bellingham Partnership, here with my colleague.
It's good to see all of you. My name is Guy Tragrasso. I'm President and CEO of the Bellingham Regional Chamber of Commerce, and we are happy collaboratively to put this on. And I think it's so interesting to be in a building filled with so much history and so much community. And at the end of the day, that's what we're trying to do. We're trying to create a dialogue so we all can learn, so we can better our community on many different fronts. We received a number of questions already, and so I know that the opinions and lived experiences in the room are different. And so it's my hope that we all can respect that and use our ears a lot today. And so I just, again, want to appreciate all of you for being here. I'm going to turn it back over to Alice.
Thank you. Before we get started, we just want to do a quick land acknowledgement. Actually, we just wanted to take a moment to acknowledge that we reside as people and are holding this actual meeting here on traditional, ancestral, unceded lands of the Lummi, Nooksack, and other Coast Salish people who have cared for and tended this land since time immemorial. We recognize that we are here because of the sacrifices forced upon them. We pay our respects to them, their elders, past and present, and their descendants. So Guy's just gonna go over the flow of the meeting, and I guess I'll start, since I'm here, talk about the housekeeping. The restrooms are downstairs. You all might have gotten a card to fill out with some questions, and we'll collect those at 6 o'clock. And then I'm hoping that we will have at least 20 minutes to answer some questions at the end of this presentation. And the reference sheet, too, that we gave you are kind of a little cheat sheet about the laws that changed last year, so you have that for your reference for context, because it's a lot. So you can take that home and learn more as well. Yeah, Guy.
Thank you, Alice. Okay, so a little bit of I was going to say a game, but it's not a game. Raise your little card if you have the half sheet of paper, the little question card. All right, so since this room is full of astute human beings, you probably recognize that on one side is to write your question. On the other side is an agenda. And so that's the agenda. I don't feel like I need to overly go through that, but just a quick synopsis of the afternoon, evening is we're going to start with our state elected officials, then move into our law enforcement officials, and then go into some service provider updates. And then we'll be getting to the Q&A at the very end. And before that, we're going to actually have some of our panelists, or excuse me, I guess we're not calling them panelists, guest testimonials. But I do want to make a small little acknowledgement of the amazing team that both Alice and I get to work with. Chantel, who's a chamber employee in the back, helped out. And of course, I think the partnership team is here scattered throughout the room. And so I just want to say thank you to all of you for doing the work in collaboration with us. So thanks for helping put on this event. Before I introduce the panelists, I'm looking around the room, and I don't have the list, so I'm not going to name everyone off, nor am I going to ask people to stand up, but I just want to acknowledge the elected officials in the room and say thank you for your service. There's a number of you that I'm looking at and who are looking at me too, so that's always not unnerving at all. So with that, I'm going to introduce the two, I guess we have three elected officials, so I'll start that way as panelists. So first and foremost, State Representative Alex Ramel of the 40th District. We have State Representative Alicia Rule of the 42nd. We have Whatcom County Sheriff Bill Elfo. We have Deputy Chief Don Almer, Bellingham Police Department. And then we have Malora Christensen of the GRACE program. And so how about we do I would say an immediate welcoming and thank you for their time tonight. Okay, so with that, one of the reasons Alice and I said, wow, actually one of the real reasons is we get a lot of phone calls and emails on this topic, as I'm sure many of you do too. And being a chamber of commerce, right? We represent business. That's who pays us, that's who joins the chamber. And so a lot of our businesses, who we both get the pleasure of representing and engaging with, have really been experiencing some things. And so we felt we can share with you the impact that some of our businesses are experiencing. Why not invite them? So we have, and I'm going to ask everyone, the three of you, to come here. We have Ian Ray of Chuck It Up Builders, and if I mispronounce anyone's name, my apologies. I know what that feels like. We've got Peter Frazier, Hotel Leo, and Kate Groen of Horseshoe Cafe. So if you three could make your way up, we'll kind of pass the mic to you. And while you're making your way up, I want another round of applause for the team at BTV 10, who will be live streaming this and recording it. So, Peter, you're first in line, so I'm going to have you come on up.
Okay. Thank you, Guy, and thank you for all of you coming out tonight about this important subject. I'm a hotelier. I own, along with Bob Hall, the Heliotrope Hotel and Hotel Leo. And as you may know, Hotel Leo is right in the downtown. We made a big investment in our downtown, and its vibrancy and all of the things that were happening previous to COVID. It was very exciting, a very exciting time to invest in the downtown and be part of my hometown's growth and the excitement of bringing back our downtown after it was severely affected by the mall opening so many years ago. We have experienced some very difficult times since COVID. In fact, all 5 of these panelists I've talked to for countless hours about these problems, along with Guy and Alice and so many others in this room. I'd like to say that I'd like to talk about one person in particular, a woman I'm going to call Cassie, and she is somebody I got to know, not personally, but I just know her by sight and sound. She's someone with behavioral health issues in our downtown, and she's very, very loud, and she's in crisis continually and creates chaos wherever she goes. I wondered about her, particularly when I saw her living behind a dumpster behind the Horseshoe a while back, and really wondered why it was that we as a community could not help her and take better care of her. Well, that led to a lot of phone calls and a lot of meetings and talking to MCOT and the police department and all the helping agencies, and really wondering why. And she was living in her own excrement, vulnerable every night. She has no one to help her. She grew up in Whatcom County. She had a relatively normal life, I know, up until not that long ago, and things went entirely south for her, and now there's crisis all around her. I have met so many people through my hotel business who are fentanyl, they're on fentanyl, methamphetamine, they are involved with criminal life. We're in an absolute crisis with drugs and criminality. And as somebody who is in the hotel business, I am in the position of welcoming people to our town to say, please come to Bellingham and enjoy yourselves. And it's getting to the point where people are not feeling safe in our downtown. And I think you all know that. You've been reading the Cascadia Daily News and the Bellingham Herald. You've passed 22 North, and you've seen what's happening on the street. I believe in all my research that these are fine, fine people who are on the job and doing the best job they can, but the deeper I look, the more crisis I see in our systems. And it's really hard to see good people like this in systems that are starting to bogged down. The courts are bogged down. Mental health system in Washington State is woefully inadequate. Our people are not wanting to be police officers right now, and the job that these folks are doing is tougher and tougher every week. So I hope that we can give them support, but what I'm seeing is all the solutions, many of the solutions come from the state. And I encourage everybody to talk to your legislative crew, because that's in the next session, that's where the solutions are going to be. And our city and our county can support that, but thank you.
Thank you. Ian, right? Ian. Yeah, just give an introduction and just, can you give us a quick, tell us about your experience with downtown public safety over the past 2 years? Yeah.
Hi, I'm Ian with Chuck and Out Builders. Peter did a great job at, I think, presenting the general state of downtown and how things have been going. Our business happens to be located on North State Street, the same block as 22 North. So for those of you who've been aware of the situation over the past year or so, we've had a front row view, from our windows of a lot of this chaos, and we've observed, just a sort of a dramatic change in the amount of drug activity, like open sex trafficking, stolen, apparently stolen goods, you name it, both in the alley behind our business and, in full view of, everyone out on the street. I think our business has been fortunate in that, we're not a retail business. That activity on the street hasn't dramatically impacted us financially, but certainly has, been worrisome for our employees, particularly people working late at night, getting to the point of being very uncomfortable, coming to work. And I've noticed a huge impact on the restaurants and other businesses on our block. So, and this really was a dramatic change, probably summer to fall of 21 is when we've noticed. Unfortunately, in the last month, we've seen things change. As I know, some of you are aware the circumstances on that particular block, have improved. But I would like to, encourage everyone in this room to continue to pay attention to the situation. It's been pretty disturbing. Some of the stories coming from neighborhood businesses. There's, been axe throwing incidents and, blatant, exchange of money for sex in the, full public view, and the police haven't been able to respond to very many of these. Both, I think legally they haven't been able to, to do much and just have been understaffed. It's been a disturbing situation. I'm, fortunate enough to have been able to travel the world to some sketchy parts of the world with my children, and in the last few years, I haven't run across anywhere that felt as uncomfortable as our block downtown, which is, that's not the Bellingham I want to live in. Thank you.
Kate.
Hey, folks. My name's Kate Grun. I own the Horseshoe Cafe downtown, and I'll be the first to admit that maybe the shoe has a bit of a reputation for having some character, and has for years, so I will get that one out of the way. That being said, in the past 2 years, there's been a really significant negative change in the atmosphere. We've always kind of had issues in that alley with some drug usage. We know this. but it's changed to now people openly selling, using, and ODing in front of the business. We're cleaning up drug paraphernalia on a daily basis, and we're having to kindly ask folks to please stop doing hard drugs in front of the door so that people can access the business if they need to. My general manager brought her toddler down and had to yell at someone to please just leave the front of the business. This is getting too much. In the past, we used to really kindly ask folks to move along. People hang out there, we get it, it's a good spot to ask for money and things like that. But we've had too many assaults on employees and too many threats of violence and brandishing of weapons that we actually now have a rule that employees aren't allowed to go outside and ask folks to move along. We ended up hiring RSU security to kind of help with a little bit of a semblance of safety, or someone they can call simply because the understaffed police department isn't able to make it out. And so when they're calling, if they make it out, it's 20 to 40 minutes later, which by that time the knife is, well down the alley. RSU comes along, which is great, and that's made a difference. But unfortunately, we're a restaurant business post-COVID who's really dealing with inflation, shortages of food and labor shortages, and now I have this shoestring budget that I'm spending on security, just so people at night can feel like they can walk to their cars. I've never been so scared for us and our employees, and it's feeling untenable, I guess, is kind of where we're at. When we hired RSU security on July 3rd, I got my first report back 2 days later on July 5th, and it was 4 pages long of incidents. So I think it's a really good, example of what we're facing, at the moment. The crew's amazing, but in the greater scheme of things, we have to ensure that they feel safe and that customers are willing to walk down the sidewalk to access the oldest restaurant in Washington State, guys. So, thank you. Thanks for being here.
All right, we're going to delve into questions for our representatives. And you guys have 3 minutes we've calculated per question, so. Per person, per question? No, per question.
So tag team as you wish.
I'll let you start.
All right. Make sure you've. Okay, first question. And again, this is to our state representatives. What laws were changed and when? So a little bit of a history lesson. Should be able to do that in a short amount of time.
There's a button.
How's that? There we go. Thank you. You want me to start, Alicia? Okay. Thanks again for hosting this, and thanks everybody for coming to listen to this discussion tonight. I'm looking forward to being part of it. And I really want to thank the 3 folks who just came up and spoke. And I will just start off and say, I live just south of downtown. I walk past Ian's business on my way into my day job, which is a block from the Horseshoe and 2 blocks from the Leopold. I see those things. My son works downtown. These are concerns that we all share. So looking at the legislation that we passed in 2021, I was just going to focus on sort of 3 things. The first is a Blake decision, which is not actually state legislation. It was a state Supreme Court decision that, in short, decriminalized simple possession of drugs in Washington State. The legislature took steps immediately after that. We kind of got hit with that out of nowhere in the middle of the legislative session. We took steps to make simple possession a misdemeanor in instances where folks had been given a chance to diversion programs. That's going to have to be revised. We need to continue working on that, and that's going to be a major priority for the next year. The other two pieces of legislation that I want to focus on, 1310 was the use of force legislation. And ultimately, the goal for that legislation was to create a standard for police use of force that prioritized de-escalation. And for context, just want to reemphasize that this came after the summer when we all saw what happened to George Floyd, in the year after a very similar instance happened in Tacoma to Manny Ellis, and where we've seen many similar or serious instances. I want to be clear that I don't think that we have, I have not seen evidence of that problem in our local police force here in Bellingham, but I think it's important to recognize that context in Washington State, that we are responding to some very bad apples and some systemic violence, or excuse me, some systemic bias in that system. And then the last piece of legislation was restricted police tactics, so specifically banned chokeholds and neck restraints. It prohibited the use of military equipment by police departments. It limited vehicle pursuits, which we will get into further in the discussion. And it set up a response to the use of unleashed police dogs. So I'll pause there, and I probably used more than my 3 minutes, but anything to add, Alicia?
Yeah, hi, thanks everybody. You know, thank you for being here. This is important to me too. I am the mother of 3 little kids, and I grew up here in Whatcom County, and the last thing I want for our community and for our next generation is to experience having to watch drug use in the alley or some of the horrific things that we've heard described here. So respectfully, I voted against most of all of those reforms and have been working really hard to support our law enforcement in a really difficult job that they have in front of them. And it's getting harder and harder by the day. I have worked closely with all the people on this panel to try to keep moving forward on pushing public safety and improving our mental health system at the same time. As you can see just walking in the building today, I also am a downtown business owner. I have a business just 2 blocks down. We've been broken into. My employees have expressed safety concerns, so this hits very near and dear to my heart because, like you, I care very much about those employees in our community and want to make sure everybody's safe. But I have been working in partnership with these folks to see what we can do continually to improve public safety at the same time that we're working on mental health issues. We see that these problems outside our door are complex and they need complex solutions. And it's going to be really important that we continue to move forward with both of those things happening in partnership with one another. When we press on one and improve one, it improves the other, and vice versa, and they need to work together. So some of the things that didn't happen yet, I introduced a bill that's a diversion tracking bill. It had to do with that Blake decision that was mentioned, and it basically said, okay, we understand that we have agreed bipartisanly to a 3 referral system. If somebody has what's called legally simple possession, 3 referrals to treatment, then there would be a bottom there. But in reality, we don't have access to treatment when and where we need it, so we need to improve and fix that right away. And in another reality, we aren't tracking that. There's nothing statewide that's consistent across Washington State. And so I will continue to do that work moving forward to get something passed around keeping some accountability and treatment available. So we need to do those in partnership with one another. My background is in social work. With that, I have some firsthand experience with the sickness of addiction. And I know that when people are in the middle of their addiction, it is really impossible to make clear decisions. And we know that because we see some of the outcomes of that. Also true for chronic mental illness. So that's one piece. I introduced a bill to at least try to make fentanyl illegal, thinking that at least we could pull that off, but wasn't able to get anywhere yet. So we'll take that back again this next session. Lastly, the ability for law enforcement officers to pursue is something that I worked really hard to get heard on the House floor. We got it out to the House floor. We got it passed off the House floor bipartisanly, sent it over to the Senate, and lost it by 1 vote. So we go back and we'll do it again because that's really important. It's an important part of the work that they do. It's an important part of being able to tackle crime. So these things work together. I'm committed to it. I'm in here with you. And with that, I'll pass on to the next question.
All right, so I think you both covered 8 of the 10 questions that we had, so pretty robust, exactly. Super efficient for an amazingly complex problem. And so I know I am more interested in what's next. And so the next question's kind of framed in that essence, and some of it was answered. So if you feel that it was answered, you can say that, but feel free to respond as you feel is adequate. Two-parter, what adjustments have been made since the legislation was originally passed, and what others are still be considered and why? And so,
Thanks. Yeah, and I guess I just really responding to Alicia and to what Peter said as well. This is a problem that sometimes gets framed as a problem for police. And when I think about the woman that Peter described, I think Cassie was her name, Cassie doesn't need police intervention. What she needs is help. And I think that's where I believe most folks on this panel will ultimately agree that our goal should be to figure out how to help folks who are in crisis. So turning to that question, so a few things that we made changes on, and I'll start with the use of force legislation. There were 2 big changes that we reversed this year, and I will say that this is one of the most difficult pieces of legislation I've dealt with. I turned around a couple of times in my thinking on this, sometimes after conversations with folks in this room, sometimes talking with advocates and with law enforcement. The biggest thing that I think is that was a mistake in the original legislation that we passed in 2021 was having an emergency clause on it, which meant it went into effect immediately, a month or so after we passed it. What that meant was that it wasn't as well understood as it should have been by the people who are going to have to implement it. The training programs weren't in place. And in the case of, in particular, involuntary treatment, an issue that had been overlooked in all of the discussion around the legislation came to light. And we should have been able to fix that before the bill went into effect. So biggest lesson learned for me, and I hope other legislators working on this, was on this policy we should not have had an emergency clause. It should have gone into effect a year later, so we had time to make sure everybody understood it before it went into effect. Because I think a lot of what folks have heard about this legislation is confusion that happened in that first month. It's still circulating as rumors. So in terms of the 2 substantive changes, the first is the involuntary treatment. So if there's a court order that somebody needs to involuntarily receive mental health treatment, under the way the legislation was initially written, a police officer could go to them and encourage them to go, but there was no use of force. There was no put a hand on somebody and say, come with me, it's time to get treatment. That is a small percentage of the cases of folks who are suffering from mental health challenges, but for those cases, that's an important authority that law enforcement needs to have. I think it was the #1 thing that Sheriff Elfo asked me to work on in this last legislative session, and that has been reversed. That the Involuntary Treatment Act is now covered under the legislation that passed. The second issue, and this was really difficult for me, is the question about whether force can be used in a case where there's probable cause or reasonable suspicion. And the difference in those standards is lots of case law behind it. But ultimately, what two things are true is what I've come to believe about this. That if police are able to use the lower reasonable suspicion standard and use force on people that they reasonably suspect of violating the law, then there will be in some cases, there will be a racially disproportionate effect. And that reasonable suspicion will fall disproportionately on young black and brown men. That's unfortunately the result of systemic injustices. It's not one person who's acting in a racist way. It's systems that have been in place since before any of us at this table were making decisions that have not been fully addressed yet. And that's one thing we know. The second thing we know is that police officers go into dangerous and chaotic situations where they don't yet have that probable cause standard, but they need somebody to sit down while they clear the area, make sure there's not somebody in the back room, et cetera. And for that reason, I voted, and the legislature as a whole voted to reinstate that that reasonable suspicion standard for the use of force in Washington State. And then, as Alicia mentioned, we did work on addressing the pursuits question. I do want to just clarify, it's not that pursuit is not allowed in any circumstances, it's that it's allowed for specific circumstances with specific, particularly with violent offenses, pursuit is allowed. And that's for the simple reason that many police pursuits end in accidents. And oftentimes that's somebody down the road, a pedestrian or another motorist. And those accidents are frequently, people are hurt and killed in those accidents. And so the legislature felt that we want to make sure that the risk of those police pursuits is worth the offense that we're responding to. I think, as Alicia mentioned, we're looking to ratchet that standard a little bit back and allow local law enforcement to have more local control. And I anticipate that, as Alicia said, we've got a window to get that done in the next legislative session.
Thank you. In terms of pursuits, it's important to me because I think at this point, respectfully, we've emboldened criminals and people who have a criminal mindset. There are lots of different, I have a background in social work, and I worked closely with folks who have intersected with all of these systems for decades now. And so it's my opinion that there's a certain type of personality that when they can get away with it, they'll continue to feel bolder and bolder to do more and more. And that is not all people who intersect with the criminal justice system, but it's a certain percentage, and I worry about that. And I see those folks having the opportunity to continue to victimize people. And I'm concerned with the amount of victimization that's happening because of that. And I think, for me, I think we can address the risk of the driving and those on pedestrian sidewalks and things by working with our law enforcement who's trained to do this. We've increased law enforcement training. I think, at that point we have to let go and say, do your job and make sure that you're protecting people from criminal behavior. So I will hold tight to that and keep working on that. The other piece that we did the fix on, I worked, the kind of internal workings of this is we usually have a prime sponsor and a number two. So I was a number two on that bill, and I'll tell you why. For me, I have been in those homes where we see domestic violence, where we see child welfare issues, where we see child neglect and abuse. And It hits very close to home. One of the very first homes I ever went out to on a case when I worked for Child Protective Services, I thought I was having a really calm conversation, and it turns out that one of the people who was the perpetrator was in a back room, almost exactly like Rep. Ramel just said. And you can be sure that my car had a nice carving of a very unkind word in it on the way out, because you just don't know. And those are the kind of situations that our first responders are going out to every single day. That's kind of a sort of more mellow one. But it's important to me that when we're thinking about these laws, that we are looking after kids in those circumstances. And I thought, in this case, our most vulnerable folks, particularly with that caretaking function of the very severe mentally ill, as well as children who are being potentially abused or exposed to really dangerous situations, really need our law enforcement to be able to go in and do a removal if necessary. We had some unclarity around what use of force actually meant. So I did formally ask the AG's office, the Attorney General's office, to get that clarity to us. It was a little slower than we would have liked. We got that new bill out, we got it passed, but it was really important for me to do that because our most vulnerable folks were being impacted by that, and our law enforcement, left with unclarity, is left without the ability to do their jobs. So that was really difficult for them to go into these precarious situations, maybe even knowing that there was risk, and not feel safe enough to be able to intervene the way they were trained to do and why they do their jobs.
Alex, Representative Ramel, looked like you wanted to respond, so.
Yeah,
go for it.
thanks. And sorry, we're going off script and over budget on our time here, but just
Okay.
wanted
We
to.
won't let you go too far over budget.
So I guess I just wanted to respond to what Rep. Rule said about emboldening criminals, because I think it's important that we kind of understand that this is happening in a much bigger context, right? We're talking a lot about legislation that passed in Washington State in 2021. What we've seen at the same time, of course, is similar trends in increase in crime across the United States. And so this is happening in red states, it's happening in blue states, it's happening in states that have passed legislation on police reform and states that haven't. So these trends are occurring everywhere. And so when we talk about solutions, and when we get to the solutions portion of the night, I've got a dozen or so ideas here. I just kind of want to level set that, you know, there are other issues at play emboldening criminals right now. So our court system is overworked and is behind, and was behind especially over the last couple of years during the pandemic, when reasonable restrictions meant we were not able to process crime. And we know we need, for criminal justice to have the intended effect, it needs to be swift and certain and fair, and if it can't be swift or certain, it's not going to work. Similarly, you know, I'm sure we'll talk at some point about our county's need for a new jail, which, you know, before the pandemic we needed a new jail. It's even more urgently apparent now, and not just for cells for criminals, but we need, as Alicia pointed out, as Rep. Rule pointed out, we need more beds for mental and behavioral health crises. So there's many of these other factors that are at play that we're seeing happen in all over the country. And so I guess I just wanted to make sure that context is there when we get to the part where we talk about solutions.
Actually, we're going to do that right now. So if you could, you've got a list.
Do I get?
We're back
Yep.
to like a minute and a half for each of you.
Yeah. I would
So-
love to hear your solutions that you
Okay,
have on your piece.
I'll go quickly through this, and we can delve in more. So we need we increased the number of slots for training new police officers last year. We need to continue to do that, and we were just talking before we started about a proposal to expand criminal justice training for a regional model, which will make it which will support local law enforcement recruitment efforts. We talked about the pursuits. The Recovery Navigator program is one that the legislature put into effect 2 years ago. I'm excited to see it starting to ramp up. That's intended to help people in recovery from drug and alcohol abuse get access to the types of services that we're providing. We need to provide more of those services. Alicia's talked about mental and behavioral health. Housing is part of this solution, both increasing the supply of housing and housing assistance for those who need it. And then I already mentioned courts. I think Representative Sharon Shoemake intends to introduce legislation to figure out if we can or how we could increase court capacity in Whatcom County. And then we'll talk later about the jail.
Great. Well, I think I talked about some of my ideas because many of them didn't go through the last session, so I plan to take them back and do it again and see if we can get the votes this time. I feel confident that we can, at least on the law enforcement side. We need both. We need complex solutions. We need to increase the number of law enforcement officers in our community. That's clear. We also have a staffing shortage problem across the state in the mental health arena. They work together, so we need to work on both of those things at the same time. Every problem that has come across my desk, for the most part, if you trace it back 1 or 2 steps, you're going to find that we have a woefully inadequate mental health system in Washington state and across the nation, really. But this has been the truth long before COVID and is definitely the truth now. People need to have access to treatment when and where they need it. That's not the case right now. So I am working on the Capital Budget Committee, which works on the facilities. I was able to get 32 beds, inpatient unit, coming to Bellingham, secured. So that is being built, that is in process. We also were able to get a detox facility that will be added on Lummi Nation. That's also another piece to this. In addition, we have so much work that you did not yet get to hear about that is the alternative response team that we're adding. That's in process now. It means that at dispatch at the 911 center, when someone calls 911, they are going to be triaged to get the appropriate response. What that does is that brings the appropriate response to the appropriate problem. It also takes some of that stress and overburdened, inappropriate workload off of our first responders. So that's, our law enforcement and our fire department, paramedics, all of that. So I can't wait for you to hear about that. I hope there's some space for that. That's something that's really important, that we're getting the proper care to the proper people, the proper response to the proper people. And that the very thing that law enforcement asked me for prior to COVID was one and only thing: please help put together a better mental health system, because that's the only thing we need at that point to make our jobs better. So now we have 2 things. We need to support our law enforcement, we need to build them back up, and we also need to continue the very, very important work on capital and operating kind of function of our mental health system. Our court system, our mental health system, our emergency department, our homelessness situations are all inextricably connected. And so if we can make some progress on one, we're going to see progress on the other. We have the way station coming in. We have multiple projects that you don't see on the street yet that are lined up, fully funded, and ready to go. Now we need to continue to do the work. We got a good start. We've got to continue to do the work. I don't know if we have an opportunity to talk about art at all. Can I pass? 3 minutes, maybe?
I'm afraid we're running out of time.
Well, I hope you'll look into it, and maybe afterward you can talk to Malora a bit about it. It's really fantastic.
Maybe she can talk about it. She'll be coming in on the end.
Great.
Thank you, guys. Now we're going to go on to the law enforcement section. The first question for both Officer Almer and Sheriff Elfo is, what's the biggest problem we need to solve right now in your minds? What do you think is the biggest problem?
Well, I'm glad to hear from the downtown business owners, and I think the problem transcends downtown Bellingham. It's a Whatcom County problem, but it's most acute. We're running into a system where we have lawlessness, chaos, and disorder, and a lot of it is attributable to some of this legislation that is passed that impedes law enforcement from being able to effectively do their jobs. On this pursuit law, if someone breaks into your home and an officer comes and detains them and they punch the officer in the nose, that's a felony, but it's not categorized as a very limited number of violent felonies for which an officer can pursue someone. We can wave goodbye as they drive away. And that's just thoroughly emboldened criminals. And I could go on for this for an hour, but I want to focus. Bellingham Police Department is the primary responders to downtown Bellingham. And as sheriff, we have a contract to provide jail services. We have statutory responsibility for jail services for all felonies. The problem with the lack of adequate space in the Whatcom County Jail has persisted for over 20 years. I actually moved to Whatcom County in 1996. On November 11th, I started as a police chief in a small city, and on the 13th, 2 days later, I was getting the results of a Blue Ribbon Committee on Criminal Justice that recommended that the jail needed to be greatly expanded. It was inadequate, falling apart, and needed to be replaced. So that's more than almost 26 years ago. Since that time, there's been 8 different citizen commissions, task forces, councils, the National Institute of Justice were all unanimous, and we need to replace this jail. The jail has become the largest mental health institution in Whatcom County, and that's because there's inadequate other options for that available. They haven't been provided. Everybody likes to talk in terms of mental health, but it's as the representative said, it's woefully inadequate at the present time. A lot of people with mental health issues need to be in jail because they're dangerous and there's no other place to put them. I have an obligation to operate the jail in a safe, legal, and constitutional manner, and we're becoming harder pressed to do that all the time. We're throwing a lot of good money after bad. $6 million to replace doors, millions of dollars to replace security systems. We replaced the electronic control system about 8 years ago. That's antiquated, no parts. Another $6 million. The elevators need to be replaced. It's really a mess, and it's time that the county step up and build a facility that's adequate, that has space in there to provide mental health services and substance abuse treatment for people that need it. And I wanted to talk a little bit about the Bakke decision. The Supreme Court overturned their own precedent from 1958. The word knowing was not in front of the word possession, and that's why they declared the controlled substance law unconstitutional, in short. The legislature responded, but they made, by inserting the word knowing, but then they went on to say make it misdemeanors instead of a felony, which we can't book anybody for a misdemeanor. We're on booking restrictions. We're lucky to be able to book burglars, and sometimes we can't book residential burglars is how bad it is. But and they have to have 2 referrals to treatment before they can even be booked, and there's no way to track that at present on a statewide or even a countywide level. We're working on that. But we used to get people off the street, bring them in, at least they would see a jail physician, they would see a jail nurse. We've saved a number of lives by administering Narcan to people that were overdosed. By arresting them, we had options to getting them into drug court, options to redeem their lives. Now we leave them in the gutter because we can't do anything with them, and that's inhumane. So there is a lot that needs to be accomplished. I urge our legislature to step up, listen to your police chiefs, listen to your sheriffs, listen to our state association. We've cried to tell them what the consequences would be. I think we've been greatly ignored, and other groups were listened to. As far as the use of force goes, there was legislation in 2018 where there's a big compromise where they changed, law enforcement and some of the people concerned about police misconduct got together and the legislature approved it, and then something happens 5 states away and they respond differently, like it's a problem germane in Washington. And that's the testimony I heard from all the committee meetings I've sat in on. They're talking about things that are happening in other states. We've got good professional law enforcement in Washington State. We've got bad apples now and then, but they quickly get identified, they get ferreted out, and they're held accountable. So, thank you.
Thank you. Officer Almer. You do.
Okay.
Yeah.
Can everybody hear me, or do I need to speak into this? Mike? Okay. Oh, that's right, the TV folks. Sorry. Prior to answering this question, I just want to give a little context. I'm currently the Deputy Chief of Operations. I've been working for the city at the police department since 1995. One of my ongoing things, a game I used to play with some of our SWAT guys, I was on SWAT for about 2 decades, is a game called Theoretical Practical. So I say theoretical, blah, 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 situation. Practical, how are you going to solve this? And so in this, my theoretical is when we're talking about legislation, a lot of the legislation had to do with accountability for police, which literally all police, all sheriffs, all deputies, we're all on board. We don't need somebody goofing it up for everybody else, right? So just please don't take this as anything bad. I would assume, since I'm not a rep or a senator or anything like that, it would be difficult to come up with legislation that has to deal with the whole state and all the problems and all the issues. I'm not naive. I don't think that there aren't any problems in law enforcement in Washington State. That would be silly. Being a staunch defender of our agency, I don't see these huge issues at our agency, and we have the data and the stats, and we're welcome to talk about that. So we've had wonderful conversations about use of force and tactics, all that stuff. So that's my little caveat, my theoretical, right? We have legislation that had to apply everywhere in the state. So as we in the cop business, there's the rules. Okay, so let's follow the rules. Well, the theoretical was the rules. The practical is sometimes the word doesn't translate into the real world, right? So my brother being an addict since 14, I told him, hey, we're going to give you a card, and we're going to give you another card, then we're going to tell you. He's like, what are you talking? He's been to rehab like 9 times, right? He's like, quitting drugs is easy. I've done it just tons of times, right? And it's just like, and he's my brother, and love him to death, and he's on a better path now and stuff, but he's like, when we do the job, it's really hard. Like, there's no way I can quantify what all you folks do, because that's just not my world. Law enforcement has been my world for basically my entire adult life, and I think the number one issue, to answer the question, is we have officers who, for right or wrong, looked at that accountability, that decertification legislation, which has some pretty broad information, and they got a little worried. And you can't do this job worried. And if I'm like, well, if I go, I know I need to put hands on you, no offense, but it's for your own good because I need to get you the help you need. Because sometimes, regardless if it's a substance abuse disorder or it's a behavioral health issue, my introducing you to the criminal justice system might be the path on your journey that gets you started to help. But now if I'm like, I don't want to go hands-on, now, with doubt comes hesitation. With hesitation can come problems. And now, just even this morning, and again, it's like we heard there was an issue downtown. A person had multiple felony warrants, and our officers come on the air and go, well, the jail won't take. Well, they'll take. It's just hard for them to hold everybody, right? Because there's certain crimes that fit and certain don't because they're overburdened. They don't have the capacity. They don't have the staff to safely run that jail. But then what does the person who calls see? Well, the cops came and they're like, okay, well, we're going to let that person walk that way. And that's not the public service that you're used to. And again, it doesn't have to do, and my personal opinion on this, it's not necessarily the legislation. We had a very restrictive pursuit policy anyways, so we're like, okay, we get it. We think on some stuff it's a little silly, but I don't work in other areas where maybe, oh, you have a license plate light out, I'm going to go on a 150-mile-an-hour chase, right? Where our agency, we're like, that would never fly. Well, it must happen somewhere because they passed legislation, right? So they have to take into account the whole state. So we're trying to come up with that complexity, like, but we're Bellingham. We think we have a good agency. We think we have a great agency. We do things by the rules. Like the sheriff said, we have professional qualified people doing it, let us do our jobs. And that's kind of hard when you have to paint with that broad brush because some people are goofing it up for others. And then for us, which I don't think is necessarily unique, but the question we're finding most having to explain is, if you don't know about our staffing challenges right now, we have some, right? And I think right now you find folks, especially in downtown where I used to be the walkabout guy, I used to be the bike cop guy, where you're like, well, we don't see anybody ever because we're triaging every call, right? So we're going to probably eclipse 80,000 calls this year. Right now we have 9 cops on duty for a city, right? And it's just we have to triage. And I hate telling you folks, you just got to wait. Or can you report this online? Because that's not the level of service that you're used to, but that's what we're getting to. And you know, talking all the time, oh, the city defunded us. Our budget's never been cut. That's just, how many people here raise your hand? Do you know people that want to be cops? Like that's it. My boy's 21 and 26, neither are cops. And they made a cognizant choice, and that's our difficulty. How do we draw people in? Chief Mertzig, who apologizes, she can't be here tonight. She's actually out of state at a labor's training. But she goes, hey, Donnie, you're kind of the numbers nerd. Let me know. How many people are going to go? We have 26 people that are 50 or over, with a combined service total of 555 years. So in 3 years, 26 people are gone. So right now, we're allotted 122 full-time staff members. Right now, we're down 29 spots. We have to hire 9, but then we have people who are injured, people at the academy who don't, not to say bad, they don't count because they're not on their own, right? Or they're in training, or they're on long-term medical. It's just we can't catch up. So my biggest thing is kind of twofold. It's some of the legislation, which I personally understand, you gotta, hey, one size fits all, sorry, here's the rules. But the other thing is, like, we really need people. And that's just not for commission. Like, we talked about dispatch center. Like, that is, we need people there. We need support services and records. We need all these people, and just maybe law enforcement just ain't kind of everybody's jam right now. So I think that's our biggest challenge.
Thank you. So it is 6 o'clock, and that's when we were going to gather up the cards. So my team, if you guys can come down and start there in the back, you'll see them. If you've got a card, just pass it to them, and then we'll go through them and see if we'll focus on the questions that haven't been addressed yet here. And I know we can't get to all of them, but we'll try. So now we're going to go on and speak with Malora Christensen about the response teams that some of these folks have referred to. And the first question I have for you are, when are the response teams slated to come online? I know some of them are about to, or maybe they already have, so tell us about the teams. Yeah.
Thanks, Allison. Thanks for the opportunity to share with you all tonight. My name's Malora. I'm a clinical social worker, and I am the Response Systems Division Manager for the Health Department, which is a new division that was created this year in the Health Department through support through the City of Bellingham and county government. And we have been operating the GRACE program for the past 4 years, which is ground level response and coordinated engagement. And we have teams partnering with community paramedics. And when BPD had behavioral health officer Sarad, we were able to work there. So I have staff who go to work at a fire station or at BPD or out in the county at Ferndale Fire. And they're working with the highest utilizers of emergency services. So familiar faces to law enforcement, EMS, our jail and legal system, and our hospital ER. So from the get-go, I would say just it's important for you all to know that there's been some really innovative, creative work happening in this county that has been supported by downtown businesses and the City of Bellingham leadership. And so, I agree with everything that has been said. We are in a really tough spot. But I'm here to share a little bit of good news. So we have the GRACE program. In 2020, we launched the LEAD program, which is Law Enforcement Assisted Diversion. Prosecutor Eric Ritchie and his team helped get that funding, and we were able to launch that. Rep. Ramel mentioned the Recovery Navigator program. We've been able to expand our LEAD program with that state funding. And then in the last year, we have been in a collaborative effort with all of our stakeholders around what it would look like to have an alternative response in the city of Bellingham to law enforcement calls. And so we are in the process of launching a new program called the Alternative Response Team. It is a pilot project. We have really some great blended funding from the state, thank you representatives, and our regional ASO, our behavioral health support organization, as well as City of Bellingham and Whatcom County dollars to work on how we can get involved at the beginning of a call, right? So we know that if you see someone in crisis and you're worried about them, you feel like you need to call 911, right? There aren't a lot of other options. And we have amazing dispatchers at Whatcom who determine, does this need to go to a law enforcement agency or does it need to go to EMS because it's a medical emergency? And they do that work. They are just incredible. They are doing amazing work and have for years and years. But now we have a new position in a partnership with Compass Health and the Mobile Crisis Outreach Team. Well, now there's a community services connector, where when the dispatcher determines that law enforcement, well, first, EMS doesn't need to respond, law enforcement doesn't need to respond. This sounds like a low acuity, nonviolent call in which there's behavioral health needs. Let's transfer this call to our services connector. And then that person who's embedded, a designated crisis responder and part of the mobile crisis outreach team, can then send out an alternative response. It might be MCOT, which is our already existing crisis team, that it just in the month of August had over 700 calls for service for that team. So again, talking about just the acuity and needs in our community. So they might dispatch MCOT, where a designated crisis responder might go, the voluntary team might go. But now they're going to have a new option in the city of Bellingham to send the alternative response team, which will be 2 individuals that are responding, a behavioral health specialist and a public health nurse. And they'll be able to respond to those calls that do not need a law enforcement response. And you know, what that looks like, those teams might be able to transport, they can de-escalate, they can meet if there's a basic need that needs to be met in the moment, they can address that. They can connect them to their service provider because we have an amazing community of service providers, but those agencies are also overburdened and stressed and part of the system that is really, really failing community members that are struggling with substance use disorder and extreme and severe and persistent mental illness. So that team will be a social services team and able to say, oh, let's connect with the homeless outreach team. Let's connect with our recovery services. Let's give them a ride to crisis triage. And it will also be an opportunity when law enforcement does show up on a call to say, okay, we've secured the scene. Actually, what this person needs is a connection to services. And so they can ask the services connector inside of dispatch to send out an alternative response. So we are in the process of hiring. We will be hiring those 4 staff. Again, this is a pilot project, and we're hoping to be able to cover 7 days a week at dispatch with the services connector, and then 7 days a week in response. And the other piece I'll tell you about is the co-responder program pilot project that we'll be doing with the sheriff's office. So we will also be hiring 2 behavioral health specialists that will be able to respond to calls with sheriff's deputies when it makes sense to have a mental health provider show up on a call, and then be able to do light and follow-up care and also connection to services. And what's exciting is that if we can continue to have the right people at the table to coordinate, then we can make sure that we're doing that together, right? And we're having the evaluation so that we know, is this the program that Bellingham wants? Is it something that could scale up? Do we need EMTs instead of public health nurses, right? What's the education level and the training that we need? And this is happening across the state. Every different city that I'm talking to, they're launching programs like this. Everybody is asking for a different response. I can go on, but...
No, that's
I'm
great.
just going to take the liberty to say, although that's true, it's Whatcom County that got the, $2.5 million to do so. So we're really taking the lead on this. It's my hope that we can take what we learn and what works well and make a statewide program.
Did you, Representative Rule, was there something else that you, like, prior, there was something you wanted to make sure to mention? Did she already speak about it?
No, I just want to make sure she got to talk about this.
Okay, good.
Thank you so
Okay.
much for asking.
All right. We actually are ready to take some questions.
I think they are still downstairs vetting them.
Oh, okay. Yes.
So first, let me say, we had the privilege of getting a lot of pre-submitted questions. I printed them out once I filtered through the Excel spreadsheet, because we all love Excel spreadsheets, and it was 5 pages. We're not getting to everyone's questions, so I'm going to apologize in advance. And so I do think it's important to understand the complex nature of public safety. And I think that's the lens that was used for the evening, and that's certainly the lens that each of our speakers presented. So before, and I'm not seeing the team, perfect, I get to dance. Right? But with that said, a couple of you mentioned something, and some of you mentioned it as well, is the racial equity component. And I think when we talk about safety, and feeling safe means a lot of different things to different people. And my hope, looking around the room, and I want everyone to look at each other, right? Like, just look around the room, not like, don't stare at people, because that makes people feel uncomfortable. This is community, right? It takes a lot of different people from a lot of different perspectives and a lot of different ideas on what success looks like to do that. So my question, and I think, Alex, you kind of brought it up from a racial equity piece. Nope, we're going to, Don, you can keep the mic. And this question would be for you and Sheriff Elfo, is can you speak on the racial equity lens on a local level in the departments?
So anyhow, we try to have a professional force, and I know there's a racial equity commission now that's been forming to look at some of the numbers and see how that bears out statistically and what impacts there are. But I got to say that when we talk about racial equity, we talk about victimization as well, and oftentimes people of racial minorities are the most likely to be victims of crime, and they need our protection, and they deserve our protection. So we don't want that notion to be lost either.
Thank you. In addition to what Sheriff Elfo said, yeah, I echo his statements and his sentiments. We have ongoing required annual training at the Bellingham Police Department for things such as implicit bias, right, racial prejudice. The state has actually a really good program. They call it CIT. Their training, they have different topics every year that we go through, and we're all mandated to go through. Believe it or not, the statewide requirement for an officer training every year is 24 hours. That's all you need to maintain your training. We're fortunate enough, due to our schedule, to make sure that usually our officers are averaging around a little over 100 hours of training, and that's before any specialty units. So like if you're K-9, SWAT, bomb squad, you get an additional training. Like our crisis negotiator teams, our hostage negotiator team, they receive additional training. So we're really fortunate, and that's one thing that we take pride on with our training component, in including those kinds of topics, which is not only mandated by the state in some sections, but are also mandated by our department. And then the difficulty also, touching back to our staffing challenges, we used to have really well-staffed and robustly staffed outreach programs, which unfortunately we've had to fold those up and take everybody back to patrol. But we were able to go into the different communities in Bellingham and engage with them, not so much as like, hey, do you have any questions, but just, okay, we're gonna go over here, we're gonna go over there, and just kind of, look, we're with you. We're part of this community too. What can we do to help, and things like that. So that's been challenging as we've brought everybody back to patrol, and it's kind of more, I don't want to trivialize it and say hit and run law enforcement, but it's really hard if you're going call to call to call to call to make those meaningful connections with all the community. And it's certainly more difficult, having been on bike patrol before, to be in a patrol car. That's really hard to talk to people, but if I'm on a bike downtown, or often would crash on the sidewalk and people would giggle, and then we just talk, hey, how about that, and things like that. We want our officers to be able to engage that way. That's why programs such as Alternative Response Team, you know, regardless of how you feel about the criminal justice system, there are certain things that police officers, cops, law enforcement are actually trained to do. And then other than that, it's like, why don't we let the pros from Dover handle those kinds of things that we're not, right? Because if I'm not proficient at it, let's be honest, I'm just kind of putting a Band-Aid over a hemorrhaging wound. And if that's not my skill set, let's leave it to the folks who do have that skill set. And we want to help because we have those partnerships, but I think you're seeing kind of the results statewide to where law enforcement has been utilized in a social worker capacity because of the lack of staffing and other components, and that's just not our thing. We're not very good at it because generally it's just like, okay, well, where do I go with you? There's a lack of services. There's like, I don't want to throw out the number, but current beds in Whatcom County for behavioral health crisis, I'm sure people are thinking, oh, there's hundreds. There's not. There's not. Think way lower, right? So that's another challenge for us. So we're delighted to work in these partnerships with alternative response, things like that. And in addition, work with community partners about things like racial equity, diversity, things like that to get our agency, especially to be reflective of the community we serve. That being said, and the broken record starts again, it's really hard to get people to apply. So if you know folks, seriously, records, dispatch, police, it's a great agency to work for, as is the sheriff's office.
All right, we're not going to compete on workforce because I've got plenty of employers in the county that would love to have an increased workforce. So we're going to get to questions. We have about 15 minutes left, and we still need a little bit of that time for closing, so let's shoot for 13, 14 minutes. So as brief as you can be while still being comprehensive. And I realize 3 people up here are elected officials. How does increasing the size of the Lighthouse mission enhance the safety/vitality of downtown? Not everybody go at one time.
Okay. Well, from an operations standpoint, like the drop-in center was their kind of beta test for base camp. And I think base camp, for those of you who are aware of the programs and the services it provides and things like that, you are seeing their self-regulatory behavior around that. And it's, for us at least, for those quality life calls, has really taken our officers out of that call mix to where we're only engaging when we need to engage. Like they call us for legit reasons, and they handle everything else. And so increasing the size and moving it back down to Old Town and things like that, it's really hard when I speak with folks in that area, like, okay, put the drop-in center out of your head because that's not what it looks like. Statistically, and because I'm a numbers guy and people have me run numbers, I looked, our calls for service to base camp since it started and things like that, it's something like freakish, like 2% of the time we're going during non-business hours. And we very rarely go there for any crimes of violence or anything huge. I mean, statistically, it is an anomaly. It runs very well. And so on one hand, our officers like it because if it's taking call load off, okay. And what you're not seeing is the tremendous influx into that surrounding community because they're getting better, because Lighthouse Mission Ministries is learning as they go as well, getting better about saying, hey, don't hang out over there, hang out over here. You want our services, do this, do this, do this, and help with that. So I think maybe that's the optimistic side of me, but I think it's going to be a lot different for that neighborhood and that impact to that neighborhood than the drop-in center was. I think they've just learned a lot more.
Okay. Any other thoughts from the panel?
I would just add that base camp is at capacity right now in August and September, and so just being able to have a place for people to sleep in our community if they're unsheltered, we're at capacity with the current facility. And I agree, Lighthouse Mission does amazing work on really a shoestring budget, and they have hired amazing staff who go above and beyond and really have built some incredible relationships with the downtown business owners trying to also, mitigate the issues that are happening there. So I think it will be an improvement.
Lighthouse Mission has nearly 100-year history of success in Whatcom County in changing people's lives. If it wasn't for the Lighthouse Mission, sometimes we release someone from jail into homelessness, and the likelihood of them committing another crime related to their homelessness is a lot higher when we could refer them to the mission. But it's not only to get them to a place to sleep that night, they take life-changing activities and really a lot of success stories. It runs primarily on private donations, so I would urge all of you to support the Lighthouse mission in spirit and financially as you can.
Okay, next question is for our state representatives. Public safety concerns are not a recent situation. Why didn't you focus more on this topic during our last session?
Oh, I assure you, we very much focused on it. It was nonstop work. And, I just want to remind people that the way our democracy works is that it really is about what you can get the votes for. And so we came out of there with what we could get at that time, but it was not for lack of a lot of difficult conversations. I mean, none of these things are easy. These are complex humans with complex societal problems, and every single one of us as legislators has a district to be accountable back to, that we go in and we look at the larger picture. We also look at our district, and we look at how can we come together. I mean, ideally, we come together and we work together as a team bipartisanly to come out with legislation that works for people. And I will tell you that I disagreed with a lot of the legislation that came out, but it was not for lack of trying to get us to a place of something that would serve people well. And I think some parts, we were able to come out with some things I feel really proud of. The art program is one that I'm very proud of. And I think this is just the beginning. Those conversations will continue to happen. This isn't the end of the road. We're going to go back and we're going to keep working on it. We're going to keep trying. And it's through those bipartisan relationships that we can have the hard conversations. We can sit face to face, eye to eye, and say, these are our shared problems. How are we going to get to solutions? Let's bring more people to the table, bring more ideas to the table, and find out what we can do to get across the line to improve public safety.
Thanks. Yeah, agree with Rep. Rule there. I guess the thing that I would just add to that is that ultimately what we need to be working on to address these challenges is systemic solutions. We need more housing. We need more mental and behavioral health support services for people in crisis. We need more beds. Those are the challenges that ultimately will be a real solution to these problems. I'm not persuaded that our solution to our homelessness crisis is to evict people from camps, for example. That's not a solution. That's chasing people around, and it's inhumane. We need to have those systemic solutions in place, and that's what I'm committed to working on, and will continue to do so in the coming years.
Okay, this next question is, I'm going to ask Sheriff Elfo, since you're the point person for this topic, and it was mentioned, if the citizens approved a new jail in November, it would be 5 to 6 years until we have additional jail beds. What is the plan in the interim? And so once Sheriff goes, anyone else feel the comment, please feel free.
I'm going to be very honest with you. We have a real problem. It's persisted for decades. We've had opportunities to replace the jail. The voters didn't approve it. We didn't have political support amongst all the elected officials or in Whatcom County to proceed. We thought we had a somewhat of a safe gap where we were going to rent jail space in Snohomish County. We were negotiating, and that became a political issue down there with the cities, and they didn't want Whatcom County's prisoners down there. They were afraid they were going to be released into Everett, which was not the case. They were going to come back here to get released, and they pulled the rug out from under us. But it's not reliable to be renting jail space somewhere else. We've rented jail space before in Yakima, where everything's going along fine for 2 or 3 months. They get a more lucrative contract, and then they give us 30 days notice. We've rented jail space in Snohomish County as 2004, 2005, I believe it was. We had it going for about 14, 15 months. They needed the space for their own needs. So that's not a reliable way of doing business. What I would look at is if there's several committees that have been established by the county council to, in addition to the 9 that have already existed, to look at, make recommendations to a jail, how big it should be, where it should be located. At this point, frankly, I really don't care where it's located. We just need to get the darn thing done so we can restore order in our community. But we need to look at a process where we're doing things concurrently. We need to move forward with the planning. We need to look forward with design, and even some permitting. I think we need to make an investment up front. So if the voters approve a funding source for the jail, and that's a big if, it's failed before, at least we're in a position to move forward more rapidly. But if it was approved tomorrow, we're told by the experts it would take 5 years, even 6 years to get it built. But if we could shave a couple of years off the process, that's a couple less years we have to deal with the problem. And even with the Snohomish County, that was going to be $3.3 million per year. It's like renting rather than owning. The money's gone. We don't have the infrastructure to continue into the future. So it's a bad investment, but I think we're in such a crisis now, we need to continue to look at other jail space that may be available around the state. And that creates a whole series of complexities for the criminal justice system. People have a right to legal defense. Well, we're housing people in SeaTac at the SCORE facility, or we're putting them in Kittitas County over in Ellensburg. How does the public defender have access? How do we get them back for court? And we get a lot of objections and a lot of operational issues that creates. So it is a, I'm going to tell you, we're in a mess. We're in a real mess.
Just to clarify, the question was about if it's approved this November. It's not going to be on the ballot this November. We're talking about next November. It won't be a special election next year. So it's more than a year out for that election. And so I guess what I would just emphasize in this discussion is the importance of spending that intervening year to make sure that we come forward with the right proposal that the citizens will approve. And that hasn't been done yet. And so we need to make sure that our county government especially is putting forward the right proposal for the right size and the right location. I think it really is important because the voters won't approve just anything, as we've seen before.
I would just add that I had the opportunity to spend a fair amount of time at our local jail recently, and on a tour, right? On a tour. Thank you for clarifying. What was clear to me is that this is an untenable situation. The jail was born right about the time I was, and I am not any longer a young lady. And it hasn't grown in our community right here. And I was born right here in Bellingham. Our community has changed drastically. And the amount of growth that we've seen and the amount of increase of social and criminal behavior has, increased to a point where it's truly untenable for the safety. It's I think one of our primary issues locally that needs to be addressed as fast as possible. I'm concerned about the safety of the people who are in there for both reasons. I'm concerned about the staff in there. So I do hope that we continue to have this conversation. We continue to move forward swiftly with a good plan on the jail. It's not necessarily a directly state issue, but I just think it's really important that we understand how this fits in with the larger picture, and that it really does impact all of the other pieces, including those court pieces and including all the other pieces that work with it.
All right. So the last question was on the jail, and I want to acknowledge that there's a component to this dialogue that is not on the panel, and that's the court system. And I want to shout out to Eric Ritchie for being willing to be part of the panel, but realizing it was already full. So maybe a topic for another time. In addition, there's a lot of particularly homeless service providers that are part of this dialogue. When we look at the questions, there's a lot. There's drug enforcement, there's criminal justice, there's court systems, there's so many things that we talked about, and yet so many more. So we could not get to all the questions, but one final question as we're running out of time. And so this would be open to anyone. What can businesses do to help make downtown safer? What is the recommended course of action when there are people sleeping outside of your business? And.
Pass. The business owners here, who has ever filled out a trespass authorization form? It's a letter, right? Okay, so, well, it's pretty antiquated, right? So what we're going to do is we're working with Public Works. We're going to come up with like a vinyl sticker type situation that we pay for, and you can stick it on your window, and it's going to have all the necessary language on it, but also the case number. One of our transfer officers said, you know, Donnie, it's hard when I drive by, and his exact example was the Horseshoe Cafe. And he goes, I drive by the Horseshoe Cafe, I'm pretty sure they don't want folks loitering in there, so I call records, I go, hey, is there a trespass authorization form on file? And they go, well, let me look, because when there's one on file, that gets a little flag in the computer. But anybody who's ever been trespassed gets a flag in the computer. So the records person said, well, there's like 390 flags, I don't think we can get through this. So we're thinking vinyl stickers, because then the copper can drive by and go, vinyl sticker, we already know that that behavior is not okay, so then we can get out and help a little bit. In the interim, and that's, I mean, we just got to come up with that in a couple months, so that's not a problem. But in the interim, if you find folks, and certainly, you know, what we tell our officers is never risk your safety unnecessarily. So if you have employees or if you have staff that you don't want engaging those folks, you can call and just say, hey, look, I know this isn't really the priority right now, but I need these people moved on because they're blocking our access and things like that. But unfortunately, then it goes into the call triage queue, and it might be quite some time, right? The vast majority of folks that I've encountered, but then again, I'm wearing a new uniform and the bat belt and all that stuff, usually comply, hey, you can't be here, can you move along, things like that. But as of late, you're seeing a little more aggressiveness. You're seeing a little more prone to violence and things like that. So never risk your or your employees' safety, and call us. Understand that the delay is likely, but you know, maybe not all the time. And so what you can do to not only protect yourself is, you know, it's called crime prevention through environmental design. Just Google CPTED, CPTED. And it's always lighting and windows and access and things like that. There's a lot you can learn on the internet about, we call it in the business hardening the target, but making it, you know, maybe that's not the situation where they want to be hanging out at and things like that. And then additionally, you know, hopefully as our staffing increases and we get back to that, you'll see a downtown walkabout, you'll see a bike patrol, things like that. But I'm not going to jump to that step too quick.
Okay. Anyone else? Going once? Oh, Malora?
Okay. You know, I was going to say, in addition to that, you know, there are resources in our community that already exist, and making sure that that communication is available to the community, that you know how to reach out to the homeless outreach team, that you know about the downtown ambassadors, that you know about 988, which is an alternative to 911 for behavioral health calls that's, you know, has come to our state, and it's a national effort. And that as the alternative response team is coming out, that you're also able to give feedback on if that's working or not. So a big part of trying a pilot project like ART is, how is it working for the downtown core? How is it working for businesses? Is it alternative? Is it the right response when it's appropriate? And also, I think there's the truth is that people are often in crisis because they have an unmet need. And sometimes when your safety is not at risk, you can introduce yourself and offer a glass of water, and that might help. But as you're saying, that's not always the case downtown. But there is also a piece to this that is the human response to crisis.
All right. I think we are there. How about a final applause for our panelists? I would like to thank our business testimonials earlier. I also want to shout out to BTV in the back for being here. And most importantly, I want to thank Alice and your amazing team. for being here, for helping put this together. And I'm going to turn it over to Alice to close us out.
Thank you. Thanks, Guy. It's been a pleasure working with you on this. I just want to thank the audience. Thanks for coming out. I know it's a beautiful day. Go out there and enjoy the summer evening. I will let you know that we're working on a downtown association meeting, downtown neighborhood association meeting. That's going to be on October 10th, and it will be at 8 o'clock. It's going to be Zoom and recorded. So if you put your name on that sign-up sheet and back, we can let you know about it. And it will really focus on service providers like Malora, all the service providers that are working downtown, what they do, what they don't do, how they're coordinating together, who to call for what. So that'll be another resource that we'll be having on our website. So thank you for coming out. And like I said, enjoy the evening. Thanks.